Hi, welcome to Dr. Updated. Gene therapy is a cutting-edge medical approach aimed at treating or preventing diseases by altering the genetic makeup of cells. It holds significant promise for treating a wide range of diseases, including genetic disorders, cancer, and cardiovascular diseases. Here's a detailed overview of gene therapy. If you're not yet subscribed to our channel, kindly subscribe and give a like. What is gene therapy? Gene therapy involves introducing genetic material into a patient's cells to correct or compensate for abnormal genes responsible for disease development. The genetic material can be delivered into the patient's cells using various techniques such as viral vectors, non-viral vectors, or gene editing tools. How does gene therapy work? 1. Delivery of genetic material. Gene therapy typically involves the delivery of therapeutic genes into the patient's cells. This can be achieved using vectors, which are vehicles used to transport the genetic material into the target cells. 2. Integration or expression of genes. Once the therapeutic genes are delivered into the target cells, they integrate into the cellular DNA or function independently to produce the desired therapeutic effect. For example, the therapeutic gene may produce a missing protein or regulate the expression of malfunctioning genes. Types of gene therapy. 1. Gene replacement therapy. This approach involves replacing a faulty gene with a functional one to restore normal cellular function. It is often used to treat genetic disorders caused by mutations in single genes. 2. Gene addition therapy. In gene addition therapy, a functional gene is introduced into the patient's cells to supplement the deficient or missing gene's activity. This approach is used to treat diseases where the addition of a specific gene product can alleviate symptoms or improve cellular function. 3. Gene editing. Gene editing techniques such as CRISPR, Cas9, allow precise modification of the DNA sequence within the cell. This technology can be used to correct disease-causing mutations, delete or insert specific genes, and modulate gene expression. Applications of gene therapy. 1. Treatment of genetic disorders. Gene therapy holds promise for treating inherited genetic disorders such as cystic fibrosis, muscular dystrophy, and hemophilia. 2. Cancer therapy. Gene therapy can be used to target cancer cells by modifying their genetic makeup to inhibit tumor growth, induce cell death, or enhance the immune response against cancer. 3. Cardiovascular diseases. In cardiovascular diseases, gene therapy aims to improve heart function, promote blood vessel growth, and reduce inflammation and clot formation. Challenges and considerations. 1. Delivery systems. Efficient delivery of genetic material into target cells remains a significant challenge in gene therapy. Viral vectors are commonly used but may elicit immune responses or have limitations in cargo capacity. 2. Safety concerns. Gene therapy carries risks such as unintended gene mutations, immune reactions, and off-target effects, which need to be carefully evaluated and minimized. 3. Ethical and regulatory considerations. Ethical concerns regarding genetic manipulation, patient consent, and equitable access to treatment need to be addressed. Regulatory agencies oversee the safety and efficacy of gene therapy products before they are approved for clinical use. Gene therapy represents a groundbreaking approach in medicine, with the potential to revolutionize the treatment of various diseases. Despite challenges and limitations, ongoing research and advancements in gene therapy offer hope for improved therapeutic outcomes and enhanced quality of life for patients with genetic and acquired diseases. Thank you so much for liking and subscribing to our channel.